Welcome back. There is new hope tonight for lung cancer patients. Researchers in New Hampshire say survival rates have improved among those with early stages of the disease. Unfortunately, lung cancer still kills more people per year than colon, breast, and prostate cancers combined. And many people often dismiss the warning signs. November is Lung Cancer Awareness Month, and tonight we're joined by Dr. Matthew Graychek from Minnesota Oncology at Abbott Northwestern to talk about the latest advancements tonight in treating this dangerous disease. Dr. Graychek, thanks so much for being here.
Thanks for having me, Liz.
Well, let's start there, Doctor. Why are the survival rates improving for lung cancer patients, and what did this research find?
Well, people are living longer with or after treatment for a lung cancer, Liz. The reasons are many. Two of the biggest are we're finding cancers earlier and treatments are improving.
Well, that is certainly good news, and I think what's always so surprising about lung cancer is we associate lung cancer with smokers, but that's not really the case. Non-smokers are at risk too.
They are. In fact, as much as 10% and probably on the rise, people that are non-smokers are having lung cancer.
What are some of the warning signs and symptoms that people often ignore?
The trouble with lung cancer in its early stages, there are no warning signs. As things progress, warning signs can be specific or non-specific, and they can be similar to those findings of many other things. For example, a cough that doesn't go away, fatigue, unexplainable weight loss, or coughing up blood-tinged sputum.
Well, you tend to have more than one symptom, and is that when you should see a doctor? I think now, nowadays it seems like we're having coughs for days on end, as parents especially. When really do you raise the red flag here?
I think, you want to be concerned about something that doesn't go away with appropriate time. So something that persists or something that escalates to one or more of the things that we talked about would certainly be a reason to contact your physician or primary care provider.
Other than avoiding smoking, what are some ways we can try to avoid lung cancer?
Well, going back to the increasing number of patients that develop lung cancer that are non-smokers, some of those are associated with high levels of radon. So patients or their families, people or their families can have their home tested for radon, and if levels are high, they can consider an abatement system. Secondhand smoke, although we don't know what particular levels are associated with lung cancer, has been shown to be a risk factor, so avoiding high levels of secondhand smoke for long periods of time.
At the beginning here, we talked about significant advancements in the treatment. Can you talk about some of those to offer some hope to people who perhaps have this terrible disease?
Sure. There are three ways that we can treat a lung cancer: radiation, chemotherapy, and surgery. Improvements in radiation have been able to focus energy on the tumor cells and minimizing the damage to surrounding healthy tissue. Improvements in chemotherapy have included targeted therapies that focus medicines on the cancer cells themselves and minimize the side effects to the rest of the body. And most recently, researchers have been able to help patients' immune system fight and kill cancer cells. On the surgery side of things, the minimally invasive techniques in surgery, including the use of robotics and thoracoscopy, have allowed patients to reduce some of the risks and the time needed to recover from treatment for lung cancer.
And I'm sure that bottom line here is that this month is especially important to get this word out.
Absolutely. November being Lung Cancer Awareness Month, we appreciate the opportunity to educate people and encourage the awareness for the disease.
All right, Dr. Graychek, thanks so much for all the work you do, and thanks for being here tonight.
Liz, thank you for having me.